want you to focus on the impact on people, because we'll get into process and structure and money and things like that, but the impact on people of a no-deal outcome. What is it, and perhaps I could start with you, Sir Chris, what is it that keeps you awake at night worrying might be the effect of a no-deal outcome on people?
Well, our issues in health are actually the same issues for deal and no deal. We have three issues that are considerably larger than all others. Those three are securing the supply of medicines, workforce questions, and reciprocal healthcare arrangements with the EU 27. Those are the three things that keep me awake on this subject.
But you said the same for deal or no deal.
Well, those are both the things we are negotiating about as a part of the withdrawal agreement and other agreements, and would be the things that in a no-deal situation we would be needing to mitigate. We don't have a different list between the two. Those are the big three things on which we relate to the Union. We're possibly a little different from other departments in that we have a small number of really quite big issues, with the vast majority of health questions, which are of course common to any Western economy, the same regardless of whether we're in the European Union or not. So we're very clear that those are our three big questions.
Are you aware of any indication that the EU 27 have given, taking the EHIC card for instance, about what position they might adopt towards that in the event of no deal?
Not in the event of no deal. We've had very good discussions about how all this would work in a deal. And in general, and I'll probably say this several times in the committee, health has not been a huge issue of contention in our dealings with the European Union. And I think most countries, and I would hope this would continue, see it as their responsibility to ensure that vulnerable people are catered for regardless of the outcome. And most people have been in conversations from that starting point, which is, I'm sure, why most of these issues haven't been hugely contentious. Most of our issues are practical ones rather than...
So it's not possible at this stage to say to people here in the UK, if you go on holiday after the 1st of April and there is no deal, and you get in a car accident and you find yourself, well, in a French hospital, how it's going to work if you have no travel insurance to pay for the cost of the medical treatment if the EU decides that, well, your EHIC card is no longer valid?
No, it's not possible to say, though obviously it will be clear before you go on holiday whether the situation is exactly the same as if you're going on holiday in the United States, where you traditionally take out travel insurance, or whether there is some subsequent arrangement. That, I'm sure, would be clear before we left, but what that would be now, no, you couldn't say.
But what about citizens who might decide to go on holiday without any travel insurance? Have you done any contingency planning on having to bring people home if other hospitals say, well, we've stabilised the patient, but that's all we're going to do?
No, not at this time. As I say, it will be very clear to people exactly the same way as if you travel to the United States at what you need to do, which will either be a successor to an EHIC scheme, or you will be making private arrangements, but that will be clear before we depart.
And are you confident that the supply of medicines, essential medicines, will be maintained in the event of no deal?
I never use words like confident. We have appropriate contingencies in place, as I'm sure you've picked up. We have asked the pharmaceutical industry to create a buffer stock or other appropriate arrangements if there is short-term disruption at the border. We are working with pharmaceutical companies on all that right now. We are pleased with their response, but it's a very complex market and a very complex supply chain. So there will be things we can do in advance, such as buffer stocks, which we are doing, and then and as no one can really predict exactly what would happen, there will be decisions we would have to make along the way. So we are confident that we are putting in place all the correct mitigations, but in an incredibly complex supply chain, it of course remains very challenging. I should say it's quite challenging in normal circumstances. There are always medicines that we are worried about at any given time. We're currently dealing with, as I suspect you have noticed, with a world shortage around EpiPens, nothing to do with exiting the Union. So, as I say, it's a very complex set of supply chains. As I say, we're doing the right mitigations, but it remains extremely difficult.
But are you able to give an assurance to patients that nothing that transpires as a result of a no-deal Brexit will prevent them from getting the medicines that they require?
And as I say, I'm not here to give, and I never do this regardless of exiting the Union. We put in the right mitigations and contingencies.
But you're not able to give that assurance?
Well, as I say, I don't do it outside. I'm asked this question a lot by committees, and in a business as complex as health, we don't issue assurances and guarantees, and nobody can.
That's very clear. Thank you so much.